Okay, here we go. Welcome, everyone. I'm Kaylee Summers. I use she, her pronouns, and I help facilitate the OCFSN Veggie Rx network here, the working group. And this is our last quarterly meeting for 2024. We've got a great agenda coming up here with program updates from a few different programs throughout Oregon. And then we're also welcoming folks from OHA who are going to give us some updates on the HRSN 1115 waiver, HRSN benefits, and have some time for Q&A with them as well. I just wanted to give a few announcements in terms of OCFSN. On November 13th, we have a network-wide virtual convening from 9 a.m. to 1 p.m. And we can drop in the registration link for that in the chat. But that will be updates and information throughout the network. So not just Veggie Rx, but also the other working groups within the Oregon Community Food Systems Network. There'll be time to talk policy, legislation, some breakout room times. So a lot of different conversations and folks that you can meet throughout Oregon that are working within the food systems world and care about very similar issues, hopefully across the network. So we'd love if you could join us for that. We also will be hosting an open house, a virtual open house, to talk about the health-related social needs learning collaborative that we'll be launching here soon for folks that are interested in being part of the food and nutrition learning collaborative that OCFSN is facilitating. So before we go over to some of the program partners that we had asked to give some program updates to, does anyone have any general announcements or updates that they'd like to give to the group? Yeah, Jacobson.
We have been selected for the HRSN medically tailored meals program for next year. So we will be probably, our guesstimate is in March, starting to deliver out and provide medically tailored meals to the community under waiver 1115. So super excited about that.
Congratulations. That's a wonderful announcement. Anyone else have any announcements that they want to make or updates? All right, I'm going to pass it over to Claire, and she's going to kind of ask a few questions or set the scene for some of the programs that we asked to give updates today.
Yeah, thanks, Kaylee. So my name's Claire Londigan. I use she, her pronouns, and I am on the somewhat newly appointed steering committee for this group. So myself, Theo, Trin, and Kaylee have been meeting frequently to really plan and make sure that our meetings are meeting the needs of the many folks who show up and want to learn from each other. Something that we saw in the registration for the last meetings, part of the reason we're asking you all to register on Zoom is to really see what your needs are and what you're hoping to get out of these meetings. And we heard kind of a desire to connect a little more deeply and understand about program operations specifics from one another. So we reached out to a few Veggie Rx and Veggie Rx style program operators and asked them to kind of give a little deeper overview of their program, how many folks they serve, what kind of model their Veggie Rx program is, and what are some either highlights from the 2024 season, things they're looking forward to, or challenges they foresee. And it's also an opportunity for those folks to pitch a question to the group if they want a little support troubleshooting. So we've asked, let's see, Megan Cahn and Madeline Snyder from Legacy, Anna Garwood from OHSU, Olivia Williams from Yamhill County, and Ava Ryan from Marion Polk Food Share to share a little more deeply. I might ask Megan Cahn and Madeline Snyder, if you all are on the call already, to maybe jump in and give us a little high-level overview of your program and any troubleshooting you wanna take care of with the group, or just highlight some things that you're looking forward to for the next year.
Good morning. We've got a couple of programs at Legacy. The one I was going to give the higher level detail about is some work that we've been doing with actually two of our partners that are on the call. I've been running a free food market once a month at Randall Children's Hospital with Shantae Johnson, who's on the call, and Jacob Valentine. The market is serving about 100 families a month. We only run it once a month. And we've been using money from a grant that we received from the Rite Aid Foundation. We advertise obviously really heavily to our clinic partners so that patients can access it. We serve folks right outside of the entrance to Randall Children's Hospital. So as people are coming and going, folks can stop. And then we end up serving a decent chunk of our employees as well in this program. It's open to the community. And we procure the food from Shantae and Art with Mudbone Grown and the Feed 'em Freedom Foundation. And then we have Jacob there doing cooking demonstrations. There have been a couple of months where he has been out with injury, and so he has generously provided pre-made meals that people were able to take instead, and that's been a huge success. That's the program that I think is most akin to a Veggie Rx program in what we're offering. I'm not going to speak in detail about the other program, but our broader program is a mostly shelf-stable food bag program that provides shelf-stable foods to all 27 of our primary care clinics. And so if an individual screens positive for food insecurity, the intention is that the staff, while checking in to see if anybody needs anything, can also offer a food bag. That's a much bigger can of worms, but just to let you know that that's also happening.
Thanks, Megan. Is there anything that you're looking forward to in the coming season, or you're planning for next year, that you want to highlight?
I'm excited to hopefully keep working with our same partners. We've got some conversations to have to make sure that they're still open and interested. But just continuing to see the joy of folks who are coming to our markets and being able to bring something that has a more positive light to a space where there's a lot of challenges, and continuing to support our local growers. And then as far as challenges go, I think it's that constant trying to figure out where we have funding for another year from Rite Aid. After that, it's that continuity planning and trying to figure out where the funds come from, and Rite Aid might pony up some more money or they might not. So that's a continuing challenge.
Awesome. Thank you, Megan. If anyone has any questions, you can feel free to leave a couple minutes to pitch them now. Otherwise, maybe I'll call on Olivia Williams to share next.
Trying to wait to see if there are any questions. Hi, everyone. I'm Olivia Williams from Yamhill County Public Health. Don't mind all the boxes behind me. We're moving buildings tomorrow, so we are living out of boxes these last couple of weeks. So I, like I said, work for Yamhill County Public Health, and part of my job position is being the hub coordinator for the Yamhill County hub of the Nutrition Organ Campaign that we do with OHSU Moore Institute. And so one of our shift groups has been working on launching a Veggie Rx program in Yamhill County for about a year. And we applied for a grant through YCCO, which is called the Community Prevention and Wellness Grant, which is very focused on evidence-based primary prevention. And we ended up getting the grant to be able to provide meal boxes through Meals on Wheels people to 50 households in Yamhill County for pregnant people or people who've given birth in the last 6 months and their whole households. And we are recruiting through Yamhill County Public Health's home visiting nurse program, because we have a pretty involved home visiting program, and are offering this to any folks. There's no income restrictions or anything like that. And our goal with trying to keep it as open as possible was to kind of catch people who might not qualify for Veggie Rx through like the new HRSN benefit or other food resource programs like SNAP and whatnot. It has been a huge kind of learning curve managing this grant and also coordinating among so many different agencies that are involved in our Nutrition Oregon hub. We are, like I said, sourcing the food from Meals on Wheels people who've been absolutely amazing to work with. They've been so helpful and accommodating through the whole thing. One struggle that I did not really anticipate is just myself working for a government agency and being the one that submitted the grant application and everything. I did not anticipate the amount of bureaucratic red tape that it has taken to make sure that we get contracts signed, grant agreements signed in a timely manner. Just to kind of give you some context, we got notified that we received the grant we had applied for in, I think, middle of July. They sent over the grant agreement on August 15th. And I think just 2 weeks ago, that got signed and put into place. And then realized we need to create an MOU with Meals on Wheels people, since we'll be contracting with them and dispersing the money to them. And realized that we would have to submitted the MOU to our contracts people, who then said, oh, wait, we need to make an entire contract. And then there were lots of questions about like, how did you select Meals on Wheels people? How many quotes did you get from other programs? And luckily I had all that information, but it was just a lot more kind of red tape than I was anticipating. I think naively, I thought like, I'm bringing money into this program to be able to do this. It shouldn't be too hard, but that's been kind of a lot of trying to keep track of and bugging people about signatures and, hey, sorry to bug you again, but any update on this? But it's been really amazing. We have our delivery date set for our first meal delivery, which will be November 7th. Meals on Wheels does all the delivery of the food boxes, and they just do one weekly delivery. And they're even providing coolers that they were able to receive through Fred Meyer, which is amazing. So families who work, who might not be able to be there through the delivery window, will be able to have those coolers set out. And then another aspect through the grant is we're trying to collect data on how nutrition, and especially nutrition through pregnancy and right after childbirth, can affect families who are going through this time in life. So collecting data on like blood pressure, baby weight, maternal weight gain, and things like that, and hope that we can really show concretely that this having food available to families, nutritious, healthy food, really makes a positive impact on their diet and just their overall well-being. And looking into the future, I think the big question is just sustainability of funding, and making sure the pressure's kind of on to show that this does work, so we can continue to receive funding or apply for new grants and some of that. But yeah, it's been really exciting, really big learning experience. And I'm so excited to finally kind of have the delivery starting in a couple of weeks. So
That's exciting. Thank you, Olivia.
yeah, thank you.
I have a question. And aside, I appreciate you highlighting kind of the administrative burden of managing funds, aside from even operating the program and getting food to people. I think that's something that many program operators face. But I'm curious, how long are the think you said the coolers were from Fred Meyer's. How long are they available for folks to pick up their food if they can't make the delivery window?
So through our referral process, Meals on Wheels people will reach out to the folks, and we know we have a set delivery window time, Thursdays from 12 to 3. And so they'll talk about, are you home during this time? If you're not, okay, do you have a cooler? And if they don't, then they will just give those donated coolers to that family to have to leave out.
Got it. Thanks.
Yeah, thank you.
Can I ask, just broadly, what's in each food box, and then what the cost is from Meals on Wheels, if you're open to sharing that?
Yeah, totally. I don't have the list right in front of me, but it's ingredients to create 5 meals per week. So we're doing 5 meals for 15 weeks, which obviously that's a lot of food, which is why the coolers are really, really helpful. But they have like a list. So it'll be each meal has a protein, vegetable, starch, bread. There's milk that comes. Shanna, I know you're on this call. Feel free to jump in if I'm missing anything. And then I can't remember exactly what the cost is, but I want to say it's around $7 per meal, but that might be off. Let me look right now while I'm thinking about all of it. And Shanna, again, feel free if you know off the top of your head.
When you say a meal, like, is it like a meal for 4 people or a meal for 5? What does that mean?
So they're individual, the ingredients, they have ingredients per person. And so we had budgeted an average of 4 people per household, but then we thought that could be a barrier for people agreeing to be part of it in case they have like 6 people living in a household or more than that. And so it's 5 meals per person in the household per week. And it's not pre-made meals, it's just ingredients. So they'll still have to prepare the meals. But we also are partnering with OSU Extension to get food hero resources out there so that they can go to the website and type in ingredients and get ideas for that to prepare the food as well.
Awesome. Thank you so much, Olivia.
Yeah, and I will find that cost per meal and put it in the chat so I make sure I have it. Oh, thank you, Shannon and Shanna. But yeah.
Perfect. Yeah, and if there are other questions, please feel free to pop them in the chat. Okay, I'll move on. Since Anna, you asked a question, do you want to share just briefly about the programs going on at OHSU?
Sure. Yeah, when Claire asked me to share, I said, well, it's not really off the ground yet, but I would be glad to share what we're working on and what the challenges we found. And, just knowing this is a work in progress, but we got a grant last fall, actually, to start a kind of Veggie Rx program with a clinic at OHSU called NICH, which stands for Novel Interventions for Children's Healthcare. So it's a clinic that works with kids with quite complex long-term medical needs whose families also have various social and economic barriers to kind of stabilizing their care and getting the care they need. So there are a team of what they call interventionists who work with each family on a very in-depth way to help them stabilize situations in their life so that their child can get the care that they need. So we wanted to add food resource as an additional tool for those interventionists. So the program has 2 components. One is medically tailored meals. The vision is for the first month to offer the medically tailored meals. And then of that, the first week, the meals for the entire family, so that children can kind of have the model of eating those foods. I don't think there's been a lot of medically tailored meals work done in the pediatric space. So I guess that's a call out for any kind of examples or information, because obviously there's a different set of kind of challenges / opportunities with working with children. Some of the kids have diabetes or different special diets. Meals on Wheels provides, there's a renal diet or an end stage renal diet. So there's kind of variations on that. And then the second component is going to be what we're calling like a healthy food prescription card. I guess one lesson learned originally when we wrote the grant, we were thinking of it as Veggie Rx. And then once we were talking to the interventionists and the providers. They're like, honestly, some of these families really need more protein or really need other types of, or just got a celiac, diagnosis or something else. And so we want to make it broader than just the produce. Then I spent a lot of months looking into different tech options, how to actually get that money in the hands of people to use at grocery stores. We were leaning towards using Income, and had a lot of conversations with them, but they don't really have an existing ready to plug and play product. So it would be a lot of back and forth developing that with them. And then IQ Pay kind of came on the scene, and now we are leaning towards working with IQ Pay, which is a digital payment platform that someone could use at a grocery store. And it's really all the mainline grocery stores, unfortunately not the small kind of co-ops at this point because of the point of sales technology. And they have an option for either all groceries or one for produce. And I think we would do a combination. So someone might get, say, $100 of all groceries and $50 of produce reloaded onto their card each month. Our biggest barrier has been so within the OHSU getting it through the finance department, they brought up the issue of IRS rules around sending 990s to anybody who's gotten over $600 in cash like assistance in the course of the year. And so we actually did some work looking into the legal issues of that through, there's a group at Harvard that does food law policy, and they did some pro bono review and chimed in that food benefits like this should not be considered taxable income because it is more of in the gift category on the IRS state. But I think there is some legal gray area around that, according to our legal counsel. So we are honestly still working through that. In the meantime, the Knight Cancer Institute social workers got a grant to do something similar and have already established the contract with IQ Pay to basically, when one of the cancer patients screens positive for food insecurity, they can load money on this IQ Pay for that patient. They are thinking of it as up to that $600 max for that program. And it's still unclear whether that $600 max would be for anything if somebody also got a gas card through a social worker, or if they're participating in research, or whether it's institution-wide. So that gets kind of complicated when some of the patients are engaged with other types of supports with social work over the course of their treatment. So honestly, that's where our kind of barrier is now. Originally, our grant was going to be for $300 per month for 6 months for that family, but with this potential barrier of this $600 limit, we might have to dial it back to stay under that limit. We are waiting for kind of our institution's policies around the issue. And what else was I going to mention? Part of it is going to be doing an evaluation. We were going to have it more as a research, but because that entails a lot more time and red tape, I think we're going to dial it back into more of like a just quality improvement evaluation around the family's experience with the program. And then the other project I wanted to mention briefly, which is kind of adjacent, but not exactly a Veggie Rx, is we have a new network called Food for Health Network in Portland metro area. So the Tri-County region with some food pantries in the area, really led by Portland Open Bible Community Pantry. And there's an app called Full where families that are discharging from Dornbecker can place an online order for groceries, and they can select exactly what they like of produce, meats, dairy, grains, etc. They can put their cultural preferences, their dietary preferences, and then within about a day, somebody from the pantry closest to their home will do home delivery right to the doorstep of that food. And then they can reorder for the next month. So we just launched that about a month ago, and so far we've had 21 families utilize the new system. All right, I'll open up to any questions about either of those.
Yeah, if there's one maybe discussion question, we could have time for that, and then maybe we'll move any other questions to the chat so we have time to get everyone in. Okay, I hear crickets, so I will move on to Ava Ryan at Marion Polk Food Share. Do you want to share a bit about your program model, maybe things that are challenging or things that are exciting coming up?
Sure. So we operate a Veggie Rx program and we serve about 100 families for 18 weeks through the summer. We start in just after July 4th, and this is actually our last week of fall distribution. And then we do a distribution for the holidays in November and December as well. And we operate like a CSA, and we'll get to where we get our food in a minute. But it's very similar to a CSA that anybody could sign up for at a local farm. And we provide exclusively vegetables and fruits. And we grow all that produce ourselves. So we have two programs that work in tandem. We have our Farm Share Rx program that serves families who are primarily low income. We partner with 3 different healthcare clinics to make that happen. The clinicians identify the folks who are going to be enrolled in our program. And we have a few different criteria. One, that they be low income, and 2, that they have some kind of dietary related illness or at risk of dietary related illness. And then we also make sure that those folks can actually participate in this program for the full time, if possible. We do have wait lists and can fill in if somebody needs to drop out for some reason. But those are our main criteria. The clinicians identify those folks, and then they just send us the list of names. And so we're really the fulfiller of those orders, essentially. Folks come to the clinics to pick up their shares if they're able to, but then we also do home delivery with the help of a bunch of volunteers as well. So about half the participants in our program get home delivery because they have some barrier to pick up. So we make sure that those folks can participate too. And then, like I said, we grow all of the produce ourselves. So this program dovetails with our youth farm program. So we operate on a 6-acre production vegetable farm. And with the help of 30 teens, we grow the 20 to 30,000 pounds of produce that we distribute all year. So we are very, very busy. And it can be very challenging to get those two programs to mesh together in a way that works for everybody. So those are kind of our big and very unique programs. And I don't think that there's anybody else on this call that does quite what we do. But there are other programs similar to ours that have very similar challenges out there in the Pacific Northwest. And so our youth are here as interns. They also do get a share. So if you want to add those folks to the folks that get served, we probably do close to about 135 shares each week, which can be anywhere from 300 to 400 people, including children, who get served. And so those are some of the things that we do, and that's what our program model looks like. We're part of a bigger organization. We are the regional food bank for Marion and Polk counties, and so we already serve a network of food banks and food pantries, and we can tell folks that if they want, additional items in addition to vegetables, that they can go out to one of their local food pantries, and we can connect them with other resources if needed. And then because we're a bigger organization, we have a full development team and a finance team, and they do all of our grant rating and grant funding and things like that. And so we are not reliant on grant funds, which is, I think, really unique for a program like this, in the sense that we have a funding stream mix of private donations as well as grant funding. And our program is not at risk of going away if we don't get a specific grant. So that's something that is very unique to nonprofits. I've been in the nonprofit world for quite some time, and that was a super exciting thing for me. And as far as things that went well this year, our farming season was just amazing. We're about 6,000 pounds over our record already, and we still have quite a few weeks to go. So that's pretty exciting. And I'll read you one quote. I haven't started looking at our post-program surveys yet, but this one stuck out to me. This person said, "I'm not usually a person who tries new things, but this helped to change that. I really enjoyed trying different things. It opened my mind to trying different things that I wouldn't have tried in the past. without the Veggie Rx, we wouldn't have eaten any veggies because we could not afford it. So it's things like that that really keep us going, and is something that we're very excited about. And one thing that we're excited about for next year is that we're hoping to expand a little bit further and take on some folks in the Sandiam Canyon. So we're working towards that to try and see if we have the agricultural capacity and the youth capacity and the staff capacity to make that happen. So it's not just for us a simple matter of, making sure we have the right funds. It's making sure that we have the time to actually grow the produce that we need. So there's a lot of moving pieces with this program, but I'm happy to take any questions if anyone has them about our very unique program.
I have one question, Ava. I'm curious if you've ever leveraged AmeriCorps members or in any capacity for your model.
We have in the past, and oftentimes there's a cost match that just doesn't make sense for us. So we have a network of volunteers that that work for us, and then we also have our 30 high school volunteers. So we have generally the staff capacity for that piece of it, but it can be a lot of management. And AmeriCorps hasn't quite fit into our model recently.
That makes sense. Thank you. If there are any other questions, we definitely have time for maybe one more before we move on. Well, if things pop up for folks, please drop them in the chat. I'll hand it maybe back to Kaylee or perhaps to Theo to take us into some Oregon Health Authority updates.
Yeah, and I just wanted to, before Theo introduces OHA folks, it may have felt a little bit rushed. We were wanting to make sure that there's a few folks from OHA that do have to hop off at 10, so we wanted to make sure we got that time in. But we can, if there's time at the end, to ask Ava and Anna and Olivia and Megan more questions, or if you have more announcements and things that you want to share from your programs too, we can make sure that we have time there. So, okay, I will pass it on to Theo. Thanks.
Good morning, and thank you all. I appreciate it. I get to introduce some cool folks, but also when we talk about health-related social needs, I just think it's important to point out we're not just talking about the needs themselves, we're talking about the goals as well as the priorities for communities, which are going to vary between community to community, right? So it's also going to vary within urban communities and rural communities. So when we're talking about health-related social needs, it's not just one thing. It's not a one-size-fits-all. So we're talking about a bunch of different things. So I have the pleasure of introducing Mariah Andrews, Shauna Kerr, and Julie Reeder. But first, I'm going to introduce Mariah, and she is the lead for the fee-for-service program, and she's going to introduce what that looks like, and then I'll ask Julie and Mariah to also, or yes, to hop on. Thanks.
Yeah, I might say something first. So hi, everybody. Julie Reeder from the HRSN, which you are correct, Theo. It is many, many things, right? Benefit for nutrition with OHA. I brought Mariah here with me today. Thank you so much, Mariah, for coming. Shauna Kerr is here too. And I actually see Laura Purdue, who was also on the nutrition work group, is here. So Laura, just calling you out there for different answers. Really, my goal today is to do some Q&A. I really appreciated the sharing. For those of you who shared what the challenges are, we also have some challenges. And just to, as always, to address any sort of information, misinformation that's out there. There's a lot of rumors. I get emails saying, I heard that you're doing this, or you're not going to do this. And so just to really, hear it from the source. About what is happening. And I appreciate all of you really talking about all the steps for readiness, and just keeping in mind that when we think about readiness, we have to think about every corner of the state, 365 days a year, for quite a broad audience. And some of that readiness is making sure that we have the same services available that we have for CCO, folks who are in a CCO, also for our members, our OHP members who are covered by fee for service. It's also called open card. And so I just thought, I wonder, how many of you know about this fee for service group and the opportunity to be a nutrition provider for fee for service, whether that's a few of you who might do medically tailored meals or those of you who run, fruit and veggie related programs. And I always like you to have a name and a face, so it's not just some person at the state, who this is. And so I just really want to introduce Mariah and let her tell you a little bit about the program. So with that, take it away, Mariah, and then I'll come back and talk more nutrition with you. Thanks.
Thanks, Julie, and it's a pleasure to meet you all. Thank you for allowing us into your space. I also was on a little early and got to hear some of your presentations, and we are just so impressed. So I think I'm excited to eat more veggies and fruits after today's call, even for breakfast. So I just wanted to have a casual conversation. I did have some slides, but I think that they're a little bit too broad, and I really wanted to highlight Julie's introduction of the population in Medicaid. So we are excited to roll out the nutrition benefit coming in November 1 for HRSN, health-related social needs services. And in the Medicaid population of 1 million members annually, there is about 90% that are primarily on a CCO enrolled. And then there's 10% that are primarily open card, but a large majority of members intersect with one another in CCO and open card land, if you will. So a member in Medicaid can have a benefit that's for physical, oral, behavioral health. I think the other one is vision. And so of those 4 categories, a member can have, say, behavioral health covered by a CCO like Health Share or Pacific Source, but they could have their physical health covered by open card. And that could just be personal preference. A large majority of the open card member population is our Native American, Alaska Native American Indian population. And so they make up about 1/3 of our open card population. And so just with regard to equity, we never want to leave out any part of the population. And so if you're enrolled as a provider with a CCO, whether it be HealthShare or Trillium or one of the 16, we'd love for you to also enroll open card and open up the opportunity so that if you are happen to be interacting with a member that is eligible or presumed eligible for HRSN, you're able to say yes to all of the Medicaid population. So I'll just pause there. That's pretty much my overview. I just wanted to keep it short, and I know we're kind of cutting in line here, I feel like. So I just wanted to make sure that if there were any questions, I'm here to answer them, and then I'll pass it back to Julie. Oh, I have a hand up. Yeah, Marcy.
Yeah, hi, this is Marcy. So I might have heard wrong, but I'm just checking in. So you mentioned something starting in November. What is it?
Oh, I'm so sorry.
Okay, I just wanted to make sure because you said November and I thought, oh my gosh, did I miss something?
November is the housing benefit, so I got stuck saying November for another presentation. You're right, it's January 1st is the nutrition benefit. So we have time to answer questions and build relationship before then. Thank you for correcting me. I'm sorry for that. How do we get connected to health-related services and being providers? That's a great question. So we have several resources we can share with the organizer, and I know Julie probably has something specific that she might have available unique to providers for nutrition, but we're happy to set up meetings with you if you have specific questions. Maybe you're already in network and you want to know more about how it would work for your organization. We'd love to meet with you one-on-one, but we certainly have resources as well online or that we can send you directly, including enrollment forms or even just FAQs.
And we can certainly share the resources, how to sign up to be a provider under fee for service. And so it really is 2 separate processes. I wish that it could be the same. So, one is sort of onboarding with a CCO, as we've talked about, if they would like to add you onto their provider network. And the second would be this separate thing, which honestly isn't too bad, in a government way. It's pretty easy, right? relatively to sign up to be a provider for this fee-for-service population, because that would allow you, again, to serve the whole breadth of OHP members, if that makes sense. And that the provider enrollment team is actually really nice and loves to help you too if you have problems along the way, Marion and Todd. So we could connect you there, and I can connect you to those resources. I'll share them out to share with you.
Really, there's a question in the chat, I don't know if you wanted to answer, about percentage of OHP members we're anticipating will qualify for nutrition benefits. Great question.
Sure. So that is a great question, and we have been working on this for the budgeting piece. And so I think it's always good to go over again who can qualify and who cannot, and that this depends on what the benefit is. And so for the things that are going to roll out January 1, so sorry to scare you there, Marcy. I mean, we're not backing it up to November, then I'd be like, even a little bit more. So January 1, we're going to roll out medically tailored meals. So I know that's a few of you, but not all of you that are here. Medically tailored meals, the assessment with a registered dietitian for medically tailored meals, and I can talk a little more about that for a few of you who are related to that. And then nutrition education. We took a tiny pause, but I'm trying to make it be tiny, on the fruit and vegetable benefit, just to make sure that we were all ready to go statewide and year round. The other aspect of that is, because housing is rolling out November 1st, housing is quite a lift. I mean, and there will be a lot of demand. And so I wanted to make sure that we had the time, place, space to roll out fruit and veggie in a with some room for breath. And I think the third factor is January probably isn't our strongest month from a produce perspective. And so I didn't want a triple whammy, I guess, for us, like, oh, it's January, and we're sort of trying to sort through housing and to make sure that we're ready to go, and to try to walk hand in hand together as much as we can, right, to set up things, because I know it's hard when we've got so many different systems out there. So that's the case, but I'm definitely in mind, especially for thinking for market season. If I put my WIC and senior farmers market hat on, I certainly don't want things to move beyond the start of that season, but I want it to be as successful and happy for folks as it can possibly be. So that's the case. And then we'll roll out a little bit later the pantry stocking benefit. And we're working very hard to make that happen on the same card that is the SNAP, that carries the SNAP benefit, that is for TANF as well, and some other support programs. And the rationale behind that is that then it can be used at any SNAP, approved retailer, right, in the state. So that opens up some of our more culturally specific stores or smaller stores that maybe wouldn't be possible under different programs. There are some advantages from administrative and monitoring piece, because as some of you who are trying to take these programs on realize, there's a lot to that, right? And then knowing as the state, we have to report to many folks, so we have to run some things. This is getting into the details, but run some things that have to go back to Medicaid, right, to the feds. We'll have to run some things that probably have to do with what is related to the SNAP card and so forth. So it's sort of complex. Yeah, estimated timeline. I'm really trying very hard to make sure we don't get past April or so for that. So I just want to make that clear for the fruit and veggie benefits seen there. So, so that is the case. So remembering for medically tailored meals that we start off with here, we're probably looking for folks. It will be a narrower scope of people. So remember, for the waiver, it's not just a clinical risk factor, but you also need to be in one of the covered populations. And so those are folks that are coming out of residential mental health or substance use treatment from a larger size facility that are, and I can send this all again, coming out of incarceration, so jail, prison, youth authority, those types of things, right? Folks who are homeless. And that's something definitely for us to talk about. It can be challenging, right? For people who don't have a permanent place to stay to be a great candidate for medically tailored meals. So that's the case. A limited slice of young adults with special health care needs, because that starts with 19 to 20-year-olds. And then also people at risk of homelessness. And I just want to be clear that there is a pretty strict HUD definition related to what at risk of homelessness is, related to where you fall in terms of your area median income. And so you have to be at 30% or less of area median income for your metropolitan statistical area. So I know sometimes we think, well, everyone who's on Medicaid should be considered at risk of homelessness, but there are some stricter definitions. So that right away narrows it down quite a bit from our general Medicaid population. And then of course, for medically tailored meals, ideally, you're looking at someone who has a nutrition sensitive medical condition, probably has some limitations related to their food prep, has met with and seen a registered dietitian, hopefully has a nutrition care plan put together, and this is part of it, right? So that, that is a narrower group of people and a narrower group of providers, honestly, who can meet those needs. For the fruit and veggie benefit, which I think has the greatest interest here, again, you need to be in one of the covered populations, right? And have something that is a current or anticipated potential nutritional risk. It's not as narrow as the medically tailored meals, obviously. And that, that can be offered regardless of, I guess, it's not restricted just to pregnant individuals or children or, adults and that sort of thing. And so again, that's the pieces there. Pantry stocking per the feds can only be offered to pregnant individuals, children, and young adults with special health care needs, who again also meet the waiver populations, right? So it's not for all pregnant individuals or all children. It's really focusing on folks that come out of transition. I also forgot to mention the people who are transitioning from Medicaid only to being dual eligible, which means they're on Medicaid and Medicare. That's probably who you might run into the most for, medically tailored meals. So that's a lot of information, right?
Thanks so much, Julie.
Yeah.
I see your hand up also,
Yeah.
Quincy. But one of the questions that really blends well with what you're saying right now was an ask about future kind of connectivity, and if there is any information on a more broad benefit for HRSN later on in the future.
Yeah, I've been asked that before, and the truth is I do not know, right? There are a lot of variables, period, happening, right, at the federal level, where it's hard to predict that. But I try not to promise and say, oh, by 2027 or 2028, it will go to everyone. That may not be the case. So I want to be honest on that and just, say, and we just have unknowns. I think there will be a continuation of HRSN in some ways, but I do not know if it will just open up to all OHP members. So that's the case.
Marcy,
Marcy, I also see you have a question. Thank you.
Yeah, thanks so much. It's always good to hear from you because I like to try to keep my organization poised, ready to start this when the time comes. So I have two questions for you. Is the produce prescription looking at working through a card system? Is that part of what's taking it a little while, or are you looking at just the pantry food stocking?
So we're looking mainly at the pantry. So I know that's a rumor that's out there. Like I'm putting the fruit and veggie on the SNAP card or something. I don't think that we're ready for that at this moment. But I also know for the long term that we are moving in some directions, right, towards cards. And so I don't anticipate that we'll be ready for that by April, for example. And so perhaps, the way that we roll this out to start is going to have some varied currencies. I know, from survey work and talking with all of you before, that there's different points of readiness for accepting electronic benefits and that sort of thing. So trying to give you the time, place, space to work through what's possible for you. But I think knowing in the future, and I think all of you have talked about that too.
Yeah, well, thank you. I appreciate you kind of clearing that up. That's awesome. Thank you. So my next question is, so I have already started my prescribers and my program on collecting medical conditions, OHP IDs and date of birth, and whether they fit into that transition population or not. And then we've added in some of the social need assessment questions as well, just to fit other requirements. Is there anything else that you can think of that would help position us to be ready for this when the time comes?
Sure. So I think it's always remembering too that the approval needs to go through this. You send the request into to your CCO/Os, right? If you live in a multiple CCO area, or here's Mariah. It doesn't go into Mariah, but you want to talk about how that request goes into fee for service, your contractor?
Sure, yeah. So our open card contractor, and including, well, for all HRSN benefits and care coordination overall, is Essentia Health. And so we work with them as an extension of us to receive your referrals or requests or questions, and they can come from a provider or a member. So with housing, for example, a lot of benefits can be self-attested, and so then a member could just reach out directly if you know someone who's interested, or if you personally want to refer someone to us. And that's just online. There's an email I could put in the chat, or a phone number they can certainly call 24 hours a day. In terms of submitting those from a provider standpoint, if you are enrolled as a provider and you want to do outreach and engagement, again, you would just submit that to Centra. They would confirm that they're enrolled, and outreach and engagement is paid at $80 an hour, up to 30 hours per member on a per calendar year. So from March through March of next year, it's 30 hours, and then it renews. But yeah, so just wanted to mention that here, and hopefully that makes this helpful.
So does that help and make sense? And again, I can meet individually with anybody because I know you're in different stages of hearing about this. So I want to make sure, that's the case. So that's what you do. You'd submit the request or have that person. You can even reach out to their CCO or the third-party contractor who handles our open card folks and go through that eligibility process. The other piece I'll just bring up, since you talked about the social needs screening, is remembering that per CMS, we need to do the 6-item food security screener from USDA to determine if that person has low or very low food security. So if you're just using one of the 1-item or 2-item screeners, that won't be sufficient. Your CCO or our third-party contractor might do that level of screening. That may not be something that you need to do, Marcy or others, at that level, but I just wanted you to be aware of that. And that was required by CMS. So yes, we can certainly share the 6-item food security scale from USDA. I also see, yes, there are summaries of the eligible populations. There are tables galore that will help you understand what the eligibility criteria is for each one of the nutrition benefits, and I'm happy to share that again. And yes, we've definitely done slides before as well. So, and then Shantae, I see you're asking about the food pantry program. So again, our pantry stocking program really isn't related to food pantry. That is a dollar amount that will go on the same card that SNAP is on, that you can use at a food retailer. So I'm happy to follow up with you if you wanted to be maybe a retailer or vendor in that way. We could talk more about how much that might work. Just also pointing out for everyone that we can't pay for foods that are donated or come through the USDA system. Does that make sense? So if you're getting things through TFAP, through the food bank system or the commodity supplemental food program, essentially CMS, Medicaid dollars can't be used for USDA foods, if that helps. So what else have I forgotten? And I don't want to take too much time because I know we sort of jumped the line there a little bit.
There's a few questions in the
Sure.
chat. One is a request to share that 6-item food security link. Another is a request to clarify if the healthcare provider should do the 6-question screener or if the 6-question screener will be done by the CCO.
Well, it could depend a little bit on your CCO process, which I know is not a helpful answer, Hannah, especially because you may see kids from lots of CCOs. But typically that should be done at the CCO level when so let's say you help someone fill out a request form that goes into, I'll say Trillium because I'm trying to stay neutral, CCOX, right? That person should review, and then they should follow up on any additional information that needs to be confirmed, and also do that 6-item screener. Yeah, I said that more just so you'll know that, you don't say, well, you passed our 1-item screener, so that's, your, type of thing, just knowing that there's additional levels. That's why I mentioned it, but great question. Yeah.
Another is there a
yeah,
summary of the
go ahead.
eligible populations for each of the nutrition benefits? And also a statement saying that I remember seeing this in a slide earlier in the year and wonder if there's an easily accessible resource online for the summary of eligible populations.
Yeah. Okay. Sorry, everybody. I froze there for a second. I wasn't trying to dodge the question. Okay, I'm back. Yes, we have summary tables that will help explain. So, these are the covered populations. These are the additional requirements, and who's available for which service. So I'm thrilled to send those out to you. So, yeah. Other really key questions? Yeah, go ahead.
Another question in the chat says, is it correct that Care Oregon will be receiving the HRSN applications for all the CCOs in HealthShare, or will each CCO have their own form?
I have not heard that. There could be something that's happening. Each CCO does have their own request form. The last time I looked at HealthShare's site, they had some separate forms depending on, for that, or if you're an OHSU client, if you're under OHSU. So that does vary a little bit. Does that help? I can research that more. Sorry about that. Okay. Yeah, Mariah, is there more that you wanted to say about the excitement of being a fee-for-service provider?
Well, I think I'm just glad to be meeting you all and that you're excited to take part in the benefit. So I think if you have any questions, we'd love to stay in touch, and I can put my email in the chat, but it sounds like we'll be sending you some email resources as well from Julie. So if you have questions unique to a CCO, we are happy to facilitate those forward too. If you have just overarching questions across the board, we hope you enroll as much as possible. And if you're near a CCO, then you probably know that which ones make sense to enroll with based on region. OpenCard is statewide, so I just wanted to make that known too, that either way, wherever you're located, we hope you do choose to enroll. We know this is a collaborative environment, so as we learn through the demonstration waiver, this first go around, we will learn from you all going into future demonstration years. So I just wanted to say, please send your feedback as well as we work through, like Julie said, all the unknowns. That's it. That's all I have, Julie.
Thank you. Wonderful. Are there more questions or concerns? And again, I'm happy to meet with all of you individually, if you'd like to answer some more specific questions for you, because I know you're all coming from different situations, and maybe different levels of readiness. And again, Shantae, I'm really happy to meet with you more to talk about that. Yeah. Anything else? Claire.
Yeah, I have a question.
Sure.
It's a follow-up about the 6-item food security assessment. So if a provider is doing outreach and education and they are a registered outreach and education provider, in order to be able to bill for kind of that service, what's their like responsibility as far as eligibility assessment? Because it seems like doing that 6-item form would maybe be good to do at that initial level in addition to the CCO level. What are your general thoughts about that?
Yeah, so there are a lot of pieces with outreach and engagement, and that doesn't mean that you're required to do the full screening. Again, you all come from different settings, but some of that could be verifying a medical diagnosis, for example, that wouldn't be appropriate, right, for all settings. So we're trying to be mindful, of especially of community-based organizations, right, that may not have that full information. So you can get, outreach and engagement as a provider, and jump in, Mariah, anytime that you want to, could be helping people fill out the request form or being aware of and gathering the documents that documents or documentation they might need, when this request goes into the CCO or the third-party contractor for fee for service, so they have those things together. Particularly for housing, there's quite a bit of documentation that's needed, for example. The other thing with outreach and engagement, and I just want to point this out, is that there is a whole new initiatives portion of the waiver, which is helping get people into SNAP and WIC, and maybe a program that has food with the child and adult care food program, making sure everybody's getting school meals, that they possibly can. And that's also, a billable outreach and engagement activity, right? So I know we're starting, I feel like, when you think about the food as medicine pyramid, and like medically tailored meals are right up here at the top. And I'm like, okay, we're going to start at the top, but let's really work on the bottom, right? Which is our population-based programs. So that's on my to-do list, is make sure everybody knows, what's really available, myths and facts, about those, and how do we get people there? Because our HRSN benefit is only a 6-month benefit, right? Which is great, but we got to think about, what after, type of thing. And so all of our work, all of our larger food systems work, that doesn't go away, so that helps.
Thank
Does
you.
that help? Yeah. Okay.
Yes, it does. I'm in the world of thinking about social needs screening and eligibility assessment generally. So that's why the question came from. Thanks.
Perfect. And the longer 6-item screener is something that I've had the OHA social determinants of health screening team add as an approved screener, for you to do. So if you wished to, you could make that your default screener. I know not everyone wants to do that, so I appreciate that too. So, other questions? Okay. I will so I've got a lot of homework of things to follow up. So the basic, eligibility tables, what are the services? Sounds like there are some pre-made training on how to sign up to be a provider for fee for service. Again, happy to connect you with that team. They are really quite wonderful. You've got Mariah's information if you just have more fee for service questions. And we're really always here for you. It's exciting, when we hear from you. So please feel free to reach out. And again, if you hear anything in the rumor mill, say, "Yes, Julie, is that really true? Is that happening?" So, the more we're all informed together, the better. So, because we're going to be in this together for a while as this grows and evolves. So that's my hope, right? That we walk along together. Marcy.
I just had clapping hands to say yes.
Okay. I guess it was like I don't know about that hand. We need more gestures, I think, in our Zoom repertoire. So with that, I know we've taken a lot of time, but just let us know and back to it. And I really loved hearing all the sharing. helps me know. It makes me feel good too that I'm not the only one. So that's the case. Thank you. We're always here for you. Appreciate it.
Thank you so much.
Back to the meeting. Thanks. Back to you, Theo.
I appreciate very much the thoughtful responses and the collaborative nature of your work. It was really wonderful to hear and to learn and to be in this space with you all. But I'm going to pass it over to Kaylee. So thanks for being here.
Thanks, y'all. Thanks, OHA team, Julie and Mariah and Shauna too for being on today, and Laura. We do really appreciate hearing right from the source of what's going on, and trying to stay away from that rumor mill for sure. But it's hard when there's a lot of changing pieces to this. So you're welcome to take up as much time in our meetings as possible to answer questions and just facilitate great communication there. I wanted to mention again, I know I mentioned at the beginning of the meeting, but if you hopped on a little bit later, OCFSN, the Oregon Community Food Systems Network, has received the community capacity building funds from EOCCO and Trillium. And so we're doing we're launching a HRSN food and nutrition provider learning collaborative. So specifically for folks who are trying to figure out, am I ready to provide services in my CCO region? Is this something that I want to do? Specifically for folks that are working in food and nutrition. So if you today have a program, are looking and starting a program, whether that's a Veggie Rx program, fruit and veg benefit program, a medically tailored meal program, maybe you're providing nutrition education, or are interested in that being a pantry stocking retailer, like Julie was saying, you know, that would be a benefit that would be available on a card that would be redeemed at a retail outlet. So if you're interested in any of those types of food as medicine programming and providing that for the eligible populations in Medicaid members for HRSN, we are holding an open house meeting on November 5th at 1 o'clock, and we'll send that out to the listserv too. But you're welcome to pop in, and that learning collaborative is a peer-led space. We want this to be really useful and valuable for folks that are jumping into this work, whether their timeline is we want to start January 1 or we want to start, you know, March of 2025, or whenever the fruit and veg benefit goes live, when we hear more updates from Julie on that. If you're interested in that and you want to work with other peers that are trying to figure out the workflow, the logistics, I know there were questions in the chat about, can I partner with someone to do the medical billing part of this? I'm really good at growing food or aggregating food and distributing that out to community members, but how do I do these other parts that are a little bit unknown or maybe take some more capacity? So working through all of those types of logistical considerations, workflow considerations, and just talking with other program operators about, like, what are those challenges? What are some of the successes? We know that when we share those in peer spaces, we can get through some of those challenges together and realize that we're not the only ones in all of this, and that there's a wealth of information there. So that open house time is really to co-create what that looks like. OCFSN will come with some ideas on that. We'll have some more details about the budget for that project, how to support people's time and capacity participating in that learning collaborative. Yeah, am I missing anything, Shin, that we should announce on that? Sorry to
No, not
catch
at
you off guard here.
all. I think the only other piece of it is with the CCBF funding that we received, we will be putting out a request for proposals for a facilitator of that group. And so we're aiming to launch that on November 1st by the latest, and have someone ready and onboarded by January 1st.
All right. I know folks have to leave for other meetings, but we'll open up the space if there are questions. I know it looks like Anna and Ava are still on the call. And I think Megan might have jumped up. I'm not seeing your name up here. But if you have questions for Anna or Ava about the programs that they presented on, if you have other announcements, questions, things that you wanted to bring up with this group, this is open forum now. Feel free to unmute yourself or put anything in chat.
I have a question for Anna. The issue of like a dollar limit that can be given or gifted to patients seems kind of like a unique issue. And I just wanted to clarify, is that because many or all of the potential recipients of the program are research participants, or is it they're just patients? Interesting.
Just patients. So basically the IRS has a rule of if anybody gets over $600, that's considered, they would need a 1099. So, you know, for example, an artist or someone who has a small business. And so there's been a interpretation of that as it doesn't have to be earned income. It could, anything that is received that is cash like. So if it was, I know, like gift cards or things like that, if it's physical food, I don't think that affects this whole thing. But if it was money or a card, it gets into this area. There, like Seattle Children's Hospital has defined it that their grocery gift cards are not counting towards that $600 limit. But other institutions do count any kind of even charity, even if it's not like an exchange like it would be for a research, as part of that, adding up to that threshold.
Julie, I see your hands raised. Do you have a question or addition to this?
Yeah, just really quickly. So I'm trying to be mic on and camera on. Just, you know, and a situation is a little different, but just reminding people that for things that are ongoing, if they were cash, they could be considered income, and that could impact eligibility for other programs, right? Government programs. And so that's why for the waiver, we're definitely having to make sure like you can only spend this on, you know, groceries, you know, for example, and we can't give cash cards, or it has to be just for fruit and veggies. So just keeping that in mind as well, that something that would be ongoing could count as regular income and could impact, you know, SNAP or TANF or other eligibilities. So please keep that in mind. The other thing is that for some people who might be receiving like Medicaid paid meals under home and community-based services, sometimes if they get additional meals, that can impact the number of hours that they get from a support person. And so I think it's just always being mindful. Don't get, you know, too trapped up in this, but realizing that some of the decisions that you could make could, you know, impact other programs. So that's all. But I appreciate, Hannah, all that you've been through on the IRS questions.
Hopefully I have a new update the next gathering.
Yeah.
Just it's all been cleared up and full steam ahead.
Yeah, so sorry, but I thought I'd throw that in.
Any other questions for Anna or anyone else? Things top of mind? It looks like Shauna also put the link to the U.S. household food security questions, that 6-part question in the chat, the link for those. All right, y'all. Well, Thank you so much. Thanks, Claire and Theo, also for co-facilitating with me today. Claire and Theo and Trin are all part of the Veggie Rx steering committee planning team. And so you'll see their names and faces more and more on these meetings too. Again, a reminder, November 5th for the Open House Learning Collaborative, or Open House to learn more about the HRSN Learning Collaborative, and then November 13th for the OCFSN wide virtual convening. And we'll get that information out, and then any information that we get from the OHA team will follow up with emails for links and resources that they send us on all of the HRSN information as well. Oh, and Shin just put the registration link in for the convening, the November 13th convening in the chat. All right, y'all. Have a great rest of your week. Thank you so much for taking your time today to be here with us.
Thanks, everyone.
Thank you.